Hello, my name is Kirsten Cunha. I'm a licensed athletic trainer at the University of Florida, and today we will be discussing the pathophysiology of concussions. The pathophysiology of concussions is described by a neurometabolic cascade. This cascade involves a complex flow of metabolic and pathophysiological events that accompany microscopic and axonal injury, and ultimately an inadequate scaling of energy between supply and demand will result in abnormal brain functioning. The normal neuron will have the capacity to release ions in an organized flow. This communication of ions, or neurotransmitters, will deliver a message to the neighboring ion and will ultimately result in appropriate cognitive and physical functioning. In the event of a concussion, when the brain is violently shaken, the neuron is going to experience a stretch, and this will cause excessive strain and microtearing of the axon and result in potassium ions leaking from these cells. This loss of potassium will trigger the cell's need for energy, which it will obtain from a process called glycolysis, or in this case, hyperglycolysis. So, as the potassium is leaking out of the cell, calcium ions are going to flood in. This exchange will ultimately result in decreased cerebral blood flow, as well as result in metabolic dysfunction. So here we are. We have our cells that are desperate to function normally. They're essentially starved for energy, and a metabolic crisis will ensue. This massive need for energy, coupled with the subsequent metabolic dysfunction, will cause an immense influx of neurotransmitters. Our neuron will be so overwhelmed as that communication with other cells is hampered, and the neuron will be left vulnerable. This fragile state raises caution. What if further injury were to ensue? What would happen if the damaged cell experienced further trauma? This whole neurometabolic cascade will take many days to normalize. The stresses and vulnerability of these neurons have left them in such a state that they must be carefully nurtured.